Hello, happy Friday to everyone. Thank you for joining us for an OSHA update. We will wait a few moments as everyone logs on and give everyone a minute to get connected. TGIF. Okay. Let's wait another moment as everyone's getting logged on. I want to make sure no one misses the information that we have to present today. It's very important. Okay, looks like we're leveling off on our sign in, so I'll go ahead and get started. My name's Cara Cherry. I'm the general manager for Patterson Dental in Los Angeles, California. We really appreciate everyone joining us today. We're working hard to bring you timely information that's going to help us get through this pandemic situation and help us get back up and running safely when the time is right. A very important part of that, obviously, is going to be infection control and PPE requirements. We're very lucky to have with us today Bill Hollowell. He is an OSHA expert. He is the CEO, founder, and president of the SHIELD Group, which focuses mainly on OSHA safety, certification, training, and compliance. Bill is a certified safety health official, and he's also an instructor at the local OSHA Training Institute. So he is extremely qualified and has worked hard to get up to date on the latest OSHA regulations that are specific to California. So this is largely geared towards California offices, but I think it will be helpful information for people anywhere. We will be holding questions until the end of Bill's presentation because it's very comprehensive. So feel free to enter questions in the Q&A box or in the chat box, but we will not be answering any questions until the end of this presentation. So with that, Bill, I will turn it over to you. Thank you so much for being with us and for doing all of the extensive research that it took to get up to speed on all of these new regulations.
Yes, thanks for having me. It's my pleasure. I always want to help Patterson. We've been a great team for many, many years, and hopefully this is going to continue and everything's going to get back to normal and we're just going to excel. So, all right. So let's get down to the basics. As Cara said, this is going to be about California, but I have a lot of CDC recommendations here that are going to be nationwide. So even though I address a lot of OSHA information, there are definitely recommendations that apply everywhere. So we'll just get into it. So what we're going to discuss today, I have a quick outline here. We're going to, where the information is available. So we're going to talk about the CDC. We're going to talk about OSHA, Cal-OSHA. I will be including links throughout the presentation. And at the end, I do have specific links that in addition to the ones I already gave you. So I highly recommend you take a picture with your phone or screenshot or whatever so you can use these links because there's a lot of good information. Patient screening, we're going to cover the bases on screening your patients to determine if you can do anything with them. We'll get into more detail on that. So the standard precautions, the basics on how you take care of your office, protecting your employees, protecting the patients. PPE, what PPE has to be worn. We're going to go through, of course, the basic PPE, and then it gets into what's new right now is the respiratory protection. So I actually cover that in detail. We'll, like I said, hopefully you won't have any questions because I give you enough information. Proper disinfection, I'm going to cover that at the end, and then training your staff. Believe it or not, training your staff is vital. Your staff needs to know what's going on, and they're uncomfortable if you don't train them because they're going to be working on patients and they have a lot of questions. So I'm giving you some links. I'm giving you some things that you can use to train your staff, keep them up to speed. Of course, we have a lot of unanswered questions right now, but you can at least use this information to answer as many as you possibly can. So we get into the COVID-19 situation has been evolving, and the recommendations will continue to evolve over the time. We are learning in real time. Everything that's happening, we are literally learning, and they're making new recommendations. They keep updating. So hopefully what I've got on this PowerPoint, you will see brings you up to speed, and it could be updated again tomorrow. We don't know. That's why I want you to have these links so you can check. I don't want anybody doing something just because they were told and then come to find out later it's changed. So you need to stay on top of this. There's much to learn about the newly emerged COVID-19, how easy it spreads, what makes it spread. Remember, it is, from what we know with COVID-19 and other coronaviruses, because we have had plenty of coronaviruses in the past, it is spread via respiratory droplets. So a lot of people go, well, I have to breathe it in. No, not necessarily. People talk, and saliva has the virus in the droplets. As we talk, it comes out of our mouth, whether we see it or not. And it can drop on the furniture, the counter, the reception desk. These are areas where it could be there, and you need to disinfect. So understand that it's not just breathing, it's contacts. And if you touch something and then wipe your eyes, that's how you catch it. It doesn't have to go through your mouth or your nose. It can actually infect somebody just from contacting your eye. So there is a lot of information out there about wearing PPE. Well, that is true, and we're going to cover all that, but just be alert to any contact surfaces. Whenever you touch them, you need to use hand hygiene, clean your hands, whether it be soap and water, hand sanitizer, whatever it may be. So we'll address a lot of that right now. All right, so I want to go over the agencies where we can get this information. Cal OSHA and OSHA. Now, OSHA is the federal, Cal OSHA is state. California has rules and regulations that supersede federal OSHA because they came up with regulations that federal OSHA doesn't have. So Fed OSHA is, everybody has to follow Fed OSHA. California has to follow Fed OSHA, but California has made specific regulations that go far and beyond what federal OSHA has. And I'm going to address a couple of those regulations in the PowerPoint. And if you're in California, you are supposed to follow these. So, and I'll give you why, how, so forth, so you can stay on top of it. And then we have the CDC. Now, the CDC, that's a government agency, but they can't enforce. They are a recommendation source. Now, OSHA can actually tell you you have to follow the CDC, and then they're the enforcement agency. But what California is saying is follow the recommendations. They're not making them rules. They're just saying follow the recommendations. And the reason is because we want to stop the spread. So the CDC, they're the ones that have come out with these recommendations that can stop the spread. So just remember that, the CDC has scientists that are testing and coming up with this stuff. You have to pay attention. You have to listen to what they say. There's a reason why they're saying it. So I'll give you the link for the CDC's COVID-19 webpage in there. So you should really check that out. A lot of great information. So let's look at it when, as a dental office, we have to work on our patients. We have to screen them, right? Screening is the most important thing we can do because we do not want to bring a positive COVID-19 patient in our office. Well, patient screening, utmost importance. The CDC actually goes over this. the CDC recommends healthcare facilities, including dental offices, evaluate patients before they arrive. How can you do that? You have to schedule them. While they're on the phone, you ask them the questions, and I'm going to go over the questions. And we even have a flow chart that the CDA, California Dental Association, has created. I highly recommend you print this flow chart, put it by your desk. So anybody that would be calling patients has that flow chart. Whenever somebody comes in, you have it. So and it says screen anyone who may be ill with or who may have been exposed to new coronavirus. So you're going to ask some questions. So some of the things that we're going to do is verify if they've traveled, right? If somebody has been out of the country, which not much of that's going on now, but they are bringing people in from other countries that have been stranded. You do have situations where they have been traveling from different areas. So you just want to find out if they've traveled or if they've were tested positive for COVID-19 at some time. You really want to know, have they been tested again to see if they're negative? Check to see if they currently have or had a cough. This is one of the basic symptoms, coughing. Now, it says had a cough, and there's a reason. If somebody has a cough, you would hear it on the phone. But if they had a cough 2 days ago, you wouldn't. And just because they're asymptomatic now doesn't mean they're not positive. So you always want to ask if they had a cough. And you want to go back 14 days, okay, because that's 2 to 14 days is what the CDC is recommending. So always ask if they have or had a cough. All right. Has the patient had shortness of breath? Well, pretty common. Most people would get shortness of breath if they exercise, but not on a daily normal rate, right? So you want to ask, have they had that? Verify whether they have a fever or not. Well, you can only do that when you're in person. Over the phone, you can ask them, have they checked? But when they come to your office, you need to verify if they have a fever. Now, those the ones at the top of this list, you do over the phone. The last one, you got to do face-to-face in your office. My recommendation is when you have a patient, you schedule them, you go through the chart that I'm getting ready to show you. When they come to your office, have them call while they're in their car and say, I'm here, and you go through the questions again. It's not going to make it, what's a couple minutes to make sure nothing's changed. Ask them. The reason why I want them to call you is very simple. We don't want them to come in your office, sit in your waiting area, and contaminate all your furniture. We want them to come in. If they're negative, they come in. If they haven't checked and you check their fever, at this point in time, you'll need to get them out of your office if they have a fever. So you want a infrared thermometer. You don't want one that you stick in their mouth. Patients are not going to want to stick a thermometer in their mouth. They don't know if it's being cleaned. I know it will be, but they don't know. So you want to use infrared if you have one and check their temperature. And if they don't have a fever, then of course you can proceed. But you don't want people standing at the front desk when other people are coming in. So you have them wait in your car, call you, and then let them in when your operatory is ready. Okay. All right. So here's the chart. Now, the CDA, California Dental Association, has put together this flow chart. It's actually really good. Has the patient tested positive? It's yes, it goes down. Anything on the yes, you're not going to work on them. That means they need to go see a medical doctor. Something needs to be arranged other than you seeing them today. The no's are going down the list. It goes, you can proceed with dental treatment. As long as they're not positive, right? So that's what the no's are for. So that link will take you to that. You can actually print that flow chart. I actually recommend you put that flow chart by your front desk. Have it there for your reception. Have it there for your front office to look at. Whether when they're on the phone, when they come in, somebody might walk in your office not scheduled. You need to ask these questions. Don't even have them sit down. Ask these questions. Check their temperature before you have them sit down. If they sit down, now you need to disinfect your waiting area. So hopefully that chart will be very important for you. All right, so the CDC has an interim infection prevention and control guidance for the dental setting. They just updated this April 8th. This is vital information. The next slides are going to cover things that are really, really important. Like I said, it is the CDC, so it is not regulatory. But let's go back to OSHA. What does OSHA say? You must provide a safe working environment for your employees. So if the CDC is recommending things, OSHA says you're supposed to provide a safe environment. Make sure that you are. So if the CDC is recommending things, you probably need to abide by that, even though it's not regulatory. It is a recommendation. So just as a friendly reminder, the CDC does have weight. Okay, now, per the CDC interim guidance, you must postpone elective procedures, surgeries, non-urgent dental visits. Services should be limited to emergency visits only. During this period of the pandemic, these actions help staff and patients stay safe, preserve personal protection equipment and patient care supplies, and expand available health system capacity. So I think that's self-explanatory. Here, deferred dental treatment. Give the patient a mask to cover his or her nose and mouth. We don't know if the patient's positive, right? This is emergency care. They come in, you have to screen them. Even though you're going to do an emergency procedure, you don't see any reason why they are positive, they passed the screen. You still should put a mask on them because we don't want them contaminating the office. You're going to take them in, you're going to do your procedures. And of course, the CDC does not recommend any procedures right now unless they are emergency. All right, so if not acutely sick, send the patient home and instruct the patient to call a medical provider. What that means, very simply, if they're not showing major symptoms, but they are showing some symptoms, we want to get them to a provider. We need to get them assessed. We need to get them treated. That's not what you're there for. You're there to do dental. So we need to get them handled before you can actually do any work on them. All right. So if acutely sick, for example, has trouble breathing, refer to the medical center. All right. Now, if emergency dental care is medically necessary for a patient who has or is suspected of having COVID-19, airborne precautions, an isolation room with negative pressure relative to the surrounding area, and use of N95 filtering disposable respirators for persons entering the room should be followed. I have never gone into a dental office that meets this. Okay, so that is why it says dental treatment should be provided in a hospital or other facilities that can treat the patient using the appropriate precautions. So if they're positive, and you know they're positive, working on them is an issue. And of course, as we go further, you'll see that the gear is not even an N95 anymore. They actually recommend what's called a PAPR, which I'll explain that in just a minute. You'll see pictures of it. So N95s shouldn't even be worn if you're working on somebody that you know is positive. All right, so you are still required to follow local laws. You must stay up to date on local laws. You must find out if they're allowing you to see patients. Right now, healthcare services, including dentistry, are categorized as essential services. But as you know, now, certain cities, certain counties, you can't even walk outside without a mask on now. So things are changing. As this progresses, things are changing. So they could say at some point, dentistry is not an issue unless, and we need to stay on top of it. So we'll just see what comes as the time goes by. All right, so screening patients. We talked a little bit about it. I want to get in a little bit more because this is vital, okay? You must screen your patients, period. I already told you what I recommend on the phone. When they come in, you take their temperature. Now, these are standard precautions. You have to do this. There's a lot more. There's a few of them I'm going to list here. But screening is the most important because that's going to prevent somebody bringing in something to your staff, to your office. Okay, proper hand hygiene. You've been watching TV, I'm sure. You have seen them talk about washing your hands, don't touch your face. Well, what is proper hand hygiene? How long do you have to wash? Well, you're supposed to wash your hands for 20 to 30 seconds. Using soap and water, and your key is you must scrub every part of your hand from your wrist down to your fingertips. You must try to get under your fingernails. So if you have long fingernails, you should use a fingernail brush. If you have short fingernails, you can literally rub it in the palm of your hand. You must use clean your cuticles. You can use your thumb to do each cuticle. These are vital areas where they're cracks, so things can hide there. So if you don't scrub them properly, you didn't get rid of it. Just putting some water and some soap on it doesn't work. You have to scrub your hands. Okay, so proper PPE. Well, when there's possible exposure, right now there's always possible exposure, so we don't know what is PPE. We're going to go over, well, in California, we have a regulation, California Code of Regulation, Title 16, Section 1005, which I will show you in just a second. It goes over what PPE is worn. So I'm going to go over a little bit more, the respirators. So that's the additional thing right now. And we'll go over a CDC recommendation on what kind of gown you should be wearing and how often it's cleaned or whatever. So, all right, so follow-up, respiratory hygiene, cough etiquette. You really, really need to have tissues in your waiting area and hand sanitizer at your reception desk. Now, do not put your hand sanitizer out in the waiting area. It will not be there, possibly, when you want it. I've gone to 2 clients since this started, and first thing I said, where's your hand sanitizer? Well, we lost 2 bottles, so now we keep it behind the reception desk. So you got to be careful. People might not have it, and they go, oh, you've got plenty. They might grab it. We don't know. But the point is, it could come up missing. So keep it at the reception desk. If you have a patient that does come in and sits down for whatever reason, which I've already told you, I recommend them sit in the car. If you do have them come in and they do cough or sneeze, make sure you give them the tissues, make sure they're available, and offer some hand sanitizer to them, not giving them the bottle, but squirt it in their hands. Okay, so make sure that they understand what proper cough etiquette is. Your employees need to know. That could be part of your training, which we'll go into that at the end. Not specifically on coughing, but you could train them on cough etiquette. That would be really good. They have to cough or sneeze into their elbow if they don't have a tissue. And of course, wash hands every time. All right, so ensure proper patient placement. Well, you don't want people in your office that are positive. You don't want anybody that you suspect in your office. They're, like I said earlier, we don't want them in the waiting area if I don't have to, because now you've created another area you need to clean. So just have them come in so they can go straight into the operatory. You don't want them sitting in the waiting area, unless you prefer that, and that's fine, but you do need to clean it after they're gone. Okay, clean and disinfect the environment appropriately. Well, I'm going to get into disinfection. You have to use a proper disinfectant. Everybody uses a Cal EPA or EPA approved disinfectant. And they have certain contact times. You need to make sure you follow those contact times, and I'm going to address that a little bit more near the end. With the EPA, they have a list, so you can find out what your contact times are. All right, so the CDC recommends you post these posters, not only for your employees, but for the patients also. So it shows the symptoms, things that they look for. It may be able to jar a memory. I know you should have asked. They should know, but visual is better. You've got to have some posters for them. Now, stop the spread of germs. That could be something they really need, because they might not realize, they should, but they might not realize that they need a tissue every time they cough or sneeze. As you can see, it covers that. So these posters are good, and you need them for both patients and employees. All right, so let's talk a little bit about Cal OSHA real fast, because so far we've been talking about things we should do. Okay, well, Cal OSHA has regulations that we have to do. So I want to make sure we understand this. California is the only state that has an aerosol transmissible disease at this point in time. I'm not saying they're not coming out, and I'm not saying the federal's not going to have one, but California has had one, and we've had one for quite a few years. So it's been there, and we need to abide by this because these are regulations. That means they're laws we are supposed to follow. Okay, so it is California Code of Regulation, Title 8, Section 5199, the aerosol transmissible disease standard. Now, the good thing about this standard is most dentists are exempt. You don't have to abide by it. When I say you don't have to abide by it, but there are 4 things you have to do to be exempt. So the government has said, okay, you can be exempt from the entire standard, but this one little part, these 4 things you have to have. So I'm going to address that. And of course, if we treat patients that we think are COVID-19 positive, the whole regulation applies. So I'm going to go over all that. Now, so Title 8, Section 5199, A2A is the section. Okay, so it's A2A. As you can see, I started with the 2 there. The following are not covered by this standard. A, outpatient dental clinics or offices are not required to comply with this standard if they meet all the following conditions. So number 1, dental procedures are not performed on patients identified to them as ATD cases or suspected ATD cases. COVID-19 is an ATD, an aerosol transmissible disease. So you can't do dental procedures on anybody that you've identified or suspect to be positive. Pretty simple, right? Number 2, you must have an injury illness prevention program. Now, most states don't have this. Federal OSHA does not require this. This is a California specific thing. An injury illness prevention program is a program that they require in California everybody to have. It must be written, of course. And for this, it must have procedures for screening patients, okay? It must have got, using the CDC guidelines, to ensure you don't bring people in that are positive. Well, I just went over how to screen people, so you have to have that. So you must have that program which goes over that and make sure you're not bringing positive people in. All right, now, employees have been trained on the screening procedure. You can't screen them unless you train them. So your employees must. Now it says section 3203. You don't have to go read that. It's a very short standard. It just says you must follow the guidelines. You must know, must be trained properly how to do it. You must train your staff how to screen. You can use the CDA chart. There you go. That CDA chart, even though that's not a government agency, that's showing you what to look for, how to screen somebody. So you just want to make sure everybody knows the symptoms. That's where the poster came in that I just showed you. All that stuff is perfect. Aerosol generating dental procedures are not performed on a patient identified through the screening procedure as presenting a possible ATD exposure risk. That very simply means if somebody goes, I think they're positive, and let's say you're in the office and somebody has some symptoms and you go, I think they're positive. You can't work on them. Even though they haven't tested positive, there's no proof. If they've had a fever recently or whatever, number 4 says you're not supposed to work on them. They currently could have an ATD. Okay, so remember the symptoms are up to 14 days, we look for these symptoms. And you'll notice I said earlier, have had. So if they've had these symptoms within the 14 days, number 4 applies. So you're really not supposed to work on them in the state of California. All right, so Cal OSHA created an interim guide that explains these requirements. And of course, it was last updated, it was updated March 28th. So I checked, it hasn't been updated since, but it could update again. But that link will take you to that interim, which explains the regulation 5199, and another regulation I haven't mentioned yet, which is 5144, which is respiratory protection. Okay, so I know it says guidance for respirator shortages. It goes over the regulation too. So that's a great source for you. I highly recommend you look at it, read it. I guarantee you shouldn't have a question after. It's pretty self-explanatory, and of course, we are talking about government law, so there's a lot of stuff. All right, now, so let's talk about the hierarchy of controls. So far, we've talked about screening. Now, if you'll notice this hierarchy, PPE is at the very bottom. Okay, so that's least effective. Administrative controls is above that. Okay, there's your screening process. Engineering controls, there's equipment out there that is made to lower the spray. Your reps know what I'm talking about, and they can go over that with you guys. They have it. So there's equipment that actually can suck in the spray coming out of the patient's mouth. That's an engineering control. That's higher up. Then we have substitution and elimination. Elimination is the most effective. What does that mean? You don't see patients. There's nobody coming in. So of course that's at the top because there's no chance of exposure. So that little pyramid, upside down pyramid right there, really puts it in perspective. PPE is the lowest form of protection. It is the last line of defense. When they tell you you have to wear PPE, that's because nothing else has actually been able to stop it. The PPE is going to protect you. Administrative controls and engineering controls, all of those things are what we look for to see how you've made it where it's not going to be a hazard for the employee. All right, so let's talk about the PPE. Standard PPE, we all know, gloves, mask, eye protection, gowns, right? Well, in California, we do have a regulation, Title 16, Section 1005, which mentions that. Now, does this apply to COVID? Of course, it's infection control. Your gloves must be worn. You must take them off before you leave the operatory. Why? Because you're going to touch things. You know, I touched my bottle of water. You're spreading things. If you're wearing your gloves when you go to grab something, you're cross-contaminating. So gloves must be removed before you leave the operatory. Mask, you wear your mask while you're working on the patient, and of course, as long as you don't touch it, you're okay, but you can't wear that mask on a second patient. Eye protection, that's keeping the splatter out of your eyes. They have to be cleaned after each patient. You can wear the mask and eye protection and the gowns out of the operatory to go grab something to come back to that patient. But if you're done with that patient, of course, they must be clean. Gowns, we'll get into that in just a minute because you'll see I want to quote what I have written there so we understand it. So I'm not just going over it twice and you're not getting an opinion, you're actually seeing what's recommended. All right, so there's this Title 16, Section 1005. So respiratory protection is the only additional PPE at this point. That's what we're hearing, that's what we're saying. N95s. Well, N95s are required, okay, but they're not going to be on the existing recommendation. They're not going to be on the regulations that we've been following all this time because dentists aren't working on people that have diseases, aerosol transmissible diseases. And you shouldn't be now. So is a respirator going to be required in your office? Probably not, right? Because you're not working on somebody that's positive. Well, like I said, I'm going to address it some more so we make sure it's clear. All right, so the standard does not apply, 5199, does not apply to you if your patient is not suspected. N95s are not required. Okay, very simple. Should you be wearing an N95? A lot of people are trying to get them, trying to make sure you have them for your office. In California, you should not be wearing an N95 unless this regulation applies to you. And there's a lot more to it than that, and I'm going to go over that with you because you should not be working on a positive patient, correct? Okay. The standard does apply if you are working on a positive patient, so therefore the N95 or higher is required. Okay, so if you've confirmed that they're positive, they've been seeing a doctor or whatever, N95s are required. There's more to it than just that. Honestly, they should not be in your office per the CDC, which we're going to go over in a minute. If you are covered by the standard, employees must be protected by NIOSH certified power air respirator. Well, what is that? That's it. We have loose fitting and we have the hood. Yeah, that's what you're supposed to wear to work on a patient. The N95 is not good enough. Who requires this? OSHA. If you're working on a patient that is positive, OSHA requires a PAPR be used, unless you can't get one. Then they say the N95 is sufficient until you're able to get a hold of the PAPR. So PAPRs are kind of expensive. I've never been in a dental office that has one. The lowest one I know of is about $1,500 for everything, up to $2,500 to $3,000. So for the good ones, I guess there are some out there that might be a little bit cheaper than that higher price. But you are supposed to use a PAPR if you're working on a positive patient. I don't recommend you work on positive patients. You don't have this. You have the maybe you have N95s. Most dentists don't even have N95s because they've never needed them. So, all right, in a non-emergency condition, covered employees must provide and ensure use of NIOSH certified respirators to all employees occupationally exposed. So I just told you what you're supposed to have, a PAPR. So how many PAPRs are you going to need? One for every employee that's occupationally exposed. You can see how the price just went up. Now it's kind of expensive to treat a patient. So I highly recommend we don't see patients that we know are positive because it can get expensive. All right, masks must be provided when respirators are not available. What does that mean? Can you use a surgical mask instead of an N95 to work on a patient? If they're positive, surgical masks aren't able to be used. Surgical masks can only be used for lower hazard tasks involving patient contact. Nothing in the mouth with a handpiece, with the air water syringe, anything that creates splatter or spray, you cannot use a surgical mask. Okay, so hopefully that just answered a whole lot of questions, because a lot of people keep asking, can I, do I, what I? Well, there it is. You're not supposed to work on them. Okay, no spray without a respirator. Okay, so the use of the highest level of personal protective equipment must be available. If available, wear gloves, gowns, eye protection, goggles, or disposable reusable face shields that cover the front and sides of the face. You'll notice it's covering it says goggles, but in a minute, I'm going to show you they don't even want goggles technically by the CDC. So, and you must use an N95 or higher level respirator during emergency dental care for patients without COVID-19. If they're with COVID-19, goggles aren't usable. You must have a full face shield. Okay, so only goggles can be used on somebody that is not positive. Okay, so disposable respirators should be removed and discarded after exiting the patient's room or area. Now, I know we have equipment out there now that can disinfect respirators, and that is something that we can do, by the way. You can disinfect your respirators as long as it's done properly. And we have equipment that's available on the market where you can put the respirator in the equipment for 30 minutes, disinfect it, reuse it. Okay, so that is something you can do. Why? Because OSHA has actually said, OSHA has actually said you can actually implement emergency procedures for that. Okay, so reusable eye protection must be cleaned and disinfected according to manufacturer's reprocessing instructions prior to reuse. Disposable eye protection should be discarded after each use. All right, so change the gown if it becomes soiled. Remove and discard the gown in a dedicated container for waste or linen before leaving the patient room or care area. Disposable gowns should be discarded after use. Cloth gowns should be laundered after each use. This is if there is suspect that they're positive. Okay, remember, that's what we're talking about. But this is a CDC recommendation, and they want you to only wear your gowns per patient. Okay, OSHA says, per the minimum standards of infection control, that you can wear a gown throughout the day, but with COVID-19, these recommendations are saying, I want it changed after each patient. So it just got a little stricter if you're following these recommendations. So you don't want to wear the same gown for each patient all day right now. It'll go back to the old rules where you wear a lab coat all day or a gown all day and dispose of it or wash it or dispose of it in the end of the day. For this COVID-19 situation, they don't want that. So the CDC is saying they should be discarded after each patient, or cloth gowns should be laundered after each patient. And that's all use, okay? It's not a regulation. This is a recommendation. All right, if a respirator is not available, use a combination of a surgical mask and a face shield. Simple. Okay, masks are not respirators. The level of a mask determines the level of protection. We hear level 1, level 3. Well, a level 1 mask is used for something that has very little spray or splatter. They're going to be a lot thinner, easier to breathe, but they don't get a lot of spray. Level 3 masks are thicker and are made to handle a lot of spray if you're using ultrasonic scaler and you're hitting a lot of spray coming out of that mouth. The level 3 mask will not get too wet too quickly. So it's not going to have to be changed as often during a procedure, but they're not respirators. N95 is the lowest respirator you can possibly get. You can go up to N100s, and then you get into the big things where you have the mask with the cartridges sitting off the side, the half face, the full face, and of course the PAPRs. But N95 is a respirator. The level 3 mask is not. It is a mask and is not meant to be used as a respirator. It doesn't seal around your face. Now, Crosstex has, I use Crosstex. I like their chart. I'm not promoting Crosstex, but I like Crosstex. I like their chart. It's very simple. It's got a lot of information on it. So I recommend you actually go check this out. And it actually puts the levels there, puts the respirator there, so you can actually see where they all fall into place. And you can print it and post it. It's a good chart. All right, so due to COVID-19 pandemic, we have shortages. I already addressed this, I do believe. During this crisis, we can actually have crisis strategies where we can reuse our PPE, our respirators. Now, or surgical masks, depending on the situation, they have equipment where we can actually sterilize or high-level disinfect these so they can be reused. Now, this equipment actually is awesome. I'm not sure how many I've read it, but every hour you can be just rotating a lot of masks or N95s. So you get to do it up to 20 times, I believe. So this is a game changer actually right now, because we're not having to throw away these things because we can't get them. So you can purchase this and you can use it. You talk to your rep, and if you're going to be working on people that are not positive, and you want to screen them for emergency situations, they're not positive, you can actually disinfect your PPE so you're not wasting them. All right, so if you're requiring your employee to wear a respirator, now we're back into some rules here. You'll see us have California Code of Regulation, Title 8, Section 5144. This is a regulation that California has on respiratory protection. This is almost an identical regulation for the federal government, okay? I use California because I'm in California, and as far as I know, most of our audience is California. So the federal government does have a respiratory protection standard, and it's almost identical to the state. When I teach this class, and I do teach this class at the OSHA Training Institute, one of the things I give my students as homework is to compare these two and give me the differences between the regulations. And there are a few. They're not major, but there are a few differences between them. So they're pretty much the same. Now, so everything I'm talking about, honestly, is going to apply to federal also. So if you are going to wear a respirator, you must follow this regulation. There's no ifs, ands, or buts about it. If you're going to have your employee wear N95, they have to go by this regulation. Okay, so you must have a written program, and you must have an administrator. The administrator can't be just a doctor or the office manager or the back office RDA, back office manager. It has to be somebody that is appropriately trained or has experience. What does that mean? Well, you have to attend my class or a class at an OSHA Training Institute. You have to have, it's a 4-day class. You must have that class to be appropriately trained, to be an administrator. Or you must have years experience in respiratory protection. And I don't know of anybody in the dental office that has ever had that. Possibly, but doubtful. So you have to have one or the other. So somebody in your, if you're going to create a program, you have to have that. I don't know if many that's going to create that. All right, so here's a kind of a layout of a program. As you can see, there's 8 elements: selection, medical evaluation, fit testing, use, maintenance and care, breathing air quality and use, training, program evaluation. Now you're going, what is all that? Well, that's why you attend the class, because not only do you learn what all this is, but you learn how to create a program. Okay, and you learn how to maintain it. So selection, we're talking about N95s. Well, there's a lot of N95s out there. There's a lot of N100s and so forth. And that's what you determine what you need, medical evaluation. Hate to break the news to everybody, you can't put on a respirator until you've had this. Doctors, I highly recommend, if you're going to require your employees to put on a respirator, you need to create a program, and you need to have a medical evaluation done on each employee. Now, it's pretty simple, and I do recommend, like I said, at OTI, I teach this class all the time, and I actually work with 3M. We all know 3M is one of the largest, actually the largest respiratory protection company. They actually have an online medical evaluation thing on their website. So you can go to their medical evaluation and sign up. So you sign up your office, but before they let you do, before they'll do the medical evaluations for you, and they have their own healthcare professionals, nurses, doctors that evaluate the questionnaire. Before they will let you submit these evaluations, you have to submit your program. So now you see how complicated this can be. So you must have a respiratory protection program. It must be submitted to them. Once it's submitted, they'll approve. Okay, now we'll do the medical evaluations. The medical evaluations are confidential. The employee does that. After they pass their medical evaluation, hopefully everybody will, then there's fit testing. Why fit testing? Well, would you want to go into a hazardous chemical site with nothing on and knowing that you're going to be breathing in things that are very bad for you? No. Well, would you want to go in with a respirator that you don't know fits? No, because it could have bad problems for you. You could die from this. Well, fit testing makes sure the mask, the respirator, fits. Everybody's face is different. Everybody has different features, and some respirators fit and some respirators don't. So you have to go through the ones that fit. All right, good. So medical evaluations, we already talked about. Good. Fit testing, I think I covered it, right? Moving right along. Okay, so fit testing is performed after they pass the evaluation. Okay. If you're not requiring your employees to wear a respirator and there are no suspected hazards, you can let them wear one, but you have to do the Appendix D to the regulation, Section 5144. Appendix D is letting them know that there are no hazards to your knowledge and whatever, and it's telling them that respirators could be an issue because you're breathing through them and they have to meet the standard, they have to be NIOSH approved, so on and so forth. Now, I actually have a link. LA actually came out with this really good information source that goes over what voluntary use is. So it explains it, which is awesome. And they have a copy of the Appendix D there. So you can use this link, print it. You can go over it with your employee. If they want to wear N95, but you're not requiring them to, you can do this, but you need to document that you went over Appendix D with them and let them sign something showing that you went over it with them. And now it's their responsibility to stay safe. But you have to make sure that it is proper PPE if needed. Okay, so, all right, so we should have a medical N95 because the medical N95s are made for splatter. The regular N95s are not proper PPE. All right, so the EPA has published a list of disinfectants with contact times. I highly recommend you go there. Does it have everything listed? No. But what it does is it has the products and their chemicals, and you can actually look at the products. If yours is not listed there, you can actually see if it's got the same chemicals, what the contact times are for their products, and they're pretty much the same. So it gives you a good idea. What's important, I'm not going to list any name brands, but you guys, I will say PD Care because this is Patterson, okay? So Patterson has a disinfectant that has a 2-minute contact time for viruses up to a 3-minute contact time. Well, for COVID-19, it does say 2 minutes. That's awesome. There is another one which I want to address. This is why I'm giving you these. I'm not going to give you the name, but there's one that is a 1-minute contact time, but for COVID-19, it's 3 minutes. So as you can see, it can vary. So you really need to go to this list and find out what your contact times are, because when you are cleaning, you don't want to go, oh, just as long as it stays wet for a minute, I'm good. If it's a 3-minute contact time, you thought it was a 1 minute, but it's actually a 3. That's a big difference. So it's not killing the virus if it's not there wet for 3 minutes. So you want to check these lists out. Okay, good. The CDA has recommendations for cleaning and disinfecting your facility. Okay, so we want to make sure that you go to this link and follow it, because these are great recommendations and they're telling you what you need to do to ensure that you're killing the virus. All right, so the disinfectant you normally use should work on COVID-19. As I said, check the list. Now, these posters, we want to use these posters. I already mentioned them earlier, but we're into the training now. So you have to train your staff. Well, these posters are perfect for training your staff. They give you a lot of great information, and your staff is going to be like, what do I do? Well, this is from the CDC. They can't argue with that. They can't say it's an opinion, whatever. You want to use information from a government source when you train your staff, because they can't question it. So always use things like this. Okay, and I gave you the link earlier in the slide for the posters. Okay, so document your training. The log must include the following: the trainer name, and qualifications. Well, I'm not qualified. Yeah, you are. You're the doctor, you're a manager, you're a safety officer. That gives you, per OSHA, you've actually had to look up something to train somebody on it. You didn't bring it off the top of your head. You had something that you were using. As a manager, you are technically qualified to train your staff. Okay, so you just put down what your title is, and that's all. It doesn't have to be a certified safety health official. You don't have to have that title to train them on this. Okay, You can't teach my class, but you can teach your employees these basic things. All right, so the subject of training, what is it? Well, disinfection, proper disinfection for COVID-19. PPE, proper PPE, proper disinfection. All these topics you can come up with very simple. Just go over, the basics to inform your staff. It's easy. The date, you gotta have the date. Per OSHA, these are 3 important things they have to see on training documents. They must see the name of the person training, the qualifications of that person, what subject it was, and what date it was done. Why? Because per OSHA, you are supposed to have annual training, okay? Okay, but it goes further than that. The annual training is supposed to cover a lot of stuff, like infection control and any updated OSHA information. But it also is periodic training. What is periodic training? Well, it can be quarterly, it can be monthly. It all depends on the number of employees you have. But what's important is it must cover new things. Okay, so COVID-19, it's new. We just started addressing this, right? Well, guess what? You're supposed to train your staff. You're supposed to go out and train your staff on COVID-19. Watch TV, pay attention to what they're talking about, go to the links, come back, update your employees. Don't just go, hey, go home and watch the news. You have to train them on the information like I gave you today, and hopefully this makes it easy for you to do that. With these links, you go there, you can print this information. It's easy to train them on it. Just fill out a training log and make sure this information is there. OSHA, if anybody's ever inspected, will look for this. This is top of their list, is training above everything else. Okay, so, and like I said, we actually do train a lot of our clients are with Patterson in California, so we actually take care of our training aides. We send them out periodically, and we go in and train them once a year. These are things that you really want to look at. All right, so document the staff training. The log must include all that and the names and signature of each employee. Why is that important? Because somebody can say they weren't trained. OSHA says you must have name and signature. Now, I've only run into this once where somebody said they couldn't do a signature or wouldn't do a signature. And I told the doctor, get a mark. A mark, if somebody has a mark, that's their mark. As long as they say that's their mark, the employees can say that's their mark. They didn't want to put a signature on it because they didn't want their signature on any paperwork. That's fine. Just give me a mark. OSHA says we need to have it signed. Okay, so names and signatures. All right, so these are additional links. Cal OSHA, the Aerosol Transmissible Disease Standard, their Title 8, Section 5199. A lot of information there. Title 8, Section 5144, that's the Respiratory Protection Standard. So those are California specific. And if you're going to have a program or you're going to see patients and you need it, you definitely need these to know these. Okay. Federal, this is an overview of COVID-19. I actually put that link there because they have a lot of good information, but it is federal. It is not California specific, but it does go over recommendations. Mainly what they're going to do is refer you to the CDC. The CDC has all the tests and all the information that they want people to see. All right, so then we have the CDC's coronavirus COVID-19. That form there, that page, you need to go look at that because that's got a lot of information. It goes over a lot of things about your PPE, disinfection, all that, okay? And then, of course, the California Department of Health, they update that page all the time too. A lot of good information. All right. Thank you for your time. I hope you learned something, of course. And now I guess it's question time.
Bill, thank you. That was really excellent and I think extremely informative.
Cool.
As we anticipated, we do have a lot of questions, but they, I think, are, we have a lot of repeat questions, and that's the good news.
Yes.
There are a lot of questions surrounding N95 mask versus KN95 masks.
Versus what?
The KN95 95,
Mhm.
K95 versus N95?
Well, remember what I was saying about N95s being the lowest version of a respirator? Any mask that is NIOSH approved, now it's got to be NIOSH approved to be able to meet the qualifications. So it doesn't matter if it's KN or N95, as long as it's NIOSH approved and it's a respirator, then OSHA is going to be fine with it. But remember what I said, you have to have a program if you're wearing a respirator. So.
Great. Then there are a lot of questions about, you know, yes, everyone is screening patients for symptoms of coronavirus, but since there are so many asymptomatic people,
Right.
what's your advice surrounding treating anyone at this time?
Well, it's going to be left up to the doctor, honestly. I don't want to give advice because they need to know their patient, they need to know their employees, and they need to know what they want to do. I can't tell somebody to not work on people. I can't tell people, oh, don't worry about it. Because if they get sick later because somebody was positive, it can't come back to me. They made that decision, not me. The thing is, you screen. And if you want to see patients and you're screening people and you determine that they're not positive, you made that decision. So that's really all I can say. And I don't think anybody else would tell you anything other than that as a government employee or somebody that's trained in it.
Okay, thank you for that. We also have, I don't know that this is your particular expertise, but a lot of people are asking questions about testing kits and testing patients before they come in.
No, I don't really, that's not my specialty. All I know is from what I've seen on TV about the test kits, they are available in hospitals. And of course they have the test sites that they're trying to pop up all over. Other than that, I really don't want to address test kits because they're, like I said, hospitals are the main ones that are using them.
And I would say from a Patterson perspective, we're staying highly engaged in the research on these testing kits and the availability. And what we've seen thus far is the rapid tests that are highly accurate are in obviously short supply, and they need to go directly to the frontline healthcare workers at this time. There are some other tests that are being called antibody tests going around, and I would just recommend that you really read through the FAQs on those. I think that will really shed some light on how accurate they are or are not in helping for this, because they are not in use for seeing if someone is currently infected with coronavirus. So at this time, there's really nothing that's readily available to the dental community on this.
Exactly.
Moving on, people are asking about 3D printed masks with filters. Are they going to be acceptable, do you think?
Right now, any surgical mask is acceptable. As a matter of fact, I've actually talked to the dental board and they're saying that the cloth mask is technically a mask that would stop splatter, and that's all they care about. It's not a respirator. And for it to be a respirator, it must be made to the specific standard of that company's respirator and approved by NIOSH, okay? Or like you said, the KN95s or whatever, the anything that's got the same qualifications in other countries but are not approved in the US, they're approving those, but those are respirators. You cannot make a 3D printed respirator unless it is to the manufacturer's qualifications to be NIOSH approved, and that's what they require. So that's the key. It's got to be NIOSH approved, so therefore it's got to meet those qualifications. Otherwise, a surgical mask, it's a mask.
And then can you just simplify the requirements surrounding treating non-positive and non-suspected positive patients right now? Like if we're going into the office tomorrow to treat an emergency, what are we required to wear if we don't suspect that they're positive?
Normal PPE. You have, per the Title 16, Section 1005, That regulation is a California regulation that says you must wear gloves, you must wear eye protection, you must wear a gown, and you must wear a mask. Those are the 4 basic items of personal protection equipment. So nothing has changed. The only thing that has changed is the recommendations on how long you can wear them, which is the CDC, saying they need to be cleaned or disposed of after each patient instead of worn all day. So that's really all there is to it. The respirators are an additional thing that has popped up because this is an aerosol transmissible disease. So there you go. So those are your basic 4. Yeah. The head covers and the booties on the feet are not a requirement unless you're in a hospital. You go into an area where they're working on positive patients, then that might be what they require there. But in our dental offices, it shouldn't be.
And to clarify, people do not need to wear an N95 mask on non-positive patients or non-suspected positive patients.
It's their choice, like I said, but if they're doing it, they have to have
level 1, level 3, so they can wear just a normal mask.
Exactly.
Per regulation.
Per regulation. Totally up to them what they want to wear. Okay.
Can you comment on face shields at all?
Well, I highly recommend face shields, of course, cover the entire face. I don't want to address a specific brand if that's not what I'm doing. They make different ones that have the elastic that go around the head. They have the ones that clamp kind of hard on the head. They have the ones that clamp on your glasses. Those are shields that cover. They go all the way above the eyes and below the chin. That is the proper. My PowerPoint just went up. Yeah. So that is the proper shields that is supposed to be worn.
Thank you for that. We have some questions about your thoughts on office air scrubbers or air filtration in the office.
Remember when I was looking at the hierarchy, I said engineering controls. That's an engineering control that is above PPE. OSHA usually does not require anything above the PPE specifically, but it says you are supposed to make it safe for the employee. So those types of things are highly recommended, but unless you're in like a hospital where you know you're going to work on positive patients, they're not required. In hospitals, they are, but in dental offices, they're not required.
Great, thank you for that. Sorry, I'm just screaming. There's also a question, will HEPA filters be required or do you recommend them for dental offices?
I highly recommend them. They're effective. I highly recommend them. I can't say that they're going to be required. Like I said before, they are an engineering control. So therefore, it's an addition to. So it's your PPE is what's going to be mandated by OSHA, unless they decide to come out with something that is more specific at this time. Right now, it's not. Engineering controls is just going to be a recommendation. And I do recommend those because they do work. And if you are working like in a hospital or you are working on a positive patient, remember we just addressed Title 8, Section 5199. That regulation says if you work on patients that are considered positive, you are supposed to have that isolation room. You are supposed to have an air exchange unit that exchanges the air 12 times per hour. You are supposed to have the HEPA filters, but that's only if you're working on positive patients. That's if 5199 applies. So that regulation not only goes over the respiratory protection, the N95s, but it also goes over how to make that room efficient for working on them. So it's got to be a negative pressure, just like a hospital. It would have to have the air exchange unit 12 times per hour per the regulation. And like I said, HEPA filters. So yeah. I don't know a lot of people that are going to reconstruct their office for that to see patients.
We're getting a lot of questions about this presentation being available after the fact. And yes, we will send a link of this webinar to everyone on the call along with the slides. So you'll have the links to all of the resources which Bill has mentioned. At Patterson, we also have a new mask sterilizer that will heat to 155 degrees and help to sterilize, I believe, 100 masks per hour, it says. So we will send information about that unit along with a new chair side vacuum / suction unit, which helps remove aerosol from the air. So we will provide you with information on these new products that could also be helpful with the engineering section of removing the virus from the air. Bill, we also have a lot of questions about tubing. For instance, if you have a nitrous oxide tubing, you know, the nasal hood is disposable, but what about the connectors?
Well, there's not a lot of recommendation, or there's no requirements on it that I know of. And as far as recommendations, the CDC would be the one, or the CDA would have recommendations on that. Therefore, recommendations. And personally, I have not seen anything on that, so I don't really want to comment on anything I haven't seen. The nose, the nodule, that needs to be disposed of. That is disposable. You buy them in bulk, throw that thing away. The tubing, I think one tubing has the power coming in. I don't think it's an issue. The one that's going out, I don't know if they have a special way that they want them disinfected. I really couldn't tell you without looking into that, because OSHA is not going to require that. That's not my specialty.
Thank you for that. Can you just outline what you believe the training requirements moving forward will be to be up to speed on these new PPE requirements, and also with the N95 being introduced into practices?
Well, like I said, this PowerPoint that you just have kind of covers that. So as far as training goes, they're going to have to train about COVID-19 and when and where. If they're going to put a program in place where they're wearing N95s, remember I said they're going to have a program administrator. That person will get all that training from the class. It's a 4-day class. It's kind of hard to give you an outline on what they're going to learn, because that 4-day class goes over all that stuff of how they're going to be able to implement it in their office. So the main thing is they have to train their employees on the program, on the PPE itself, the respirators, and all that. I mean, I don't know how to make it more simple than that. They need to be properly trained so they can train the staff. It's a lot of training. It's a 4-day class, 8 hours a day.
That's a lot of training.
Yeah.
Sorry, I know there's an echo, but I'm not sure how to fix that.
All right, I'm sorry. Maybe it's
not on when I speak. There's an echo on your end, I believe.
Okay.
We are getting a lot of questions surrounding temperature checks. Is there a number for the temperature that should not be, that after that point you can't see a patient?
In the rooms? Are you talking about in your
temperature
facility?
When you're pre-screening patients.
Oh,
for COVID
well,
coming in.
the CDC does have something. It's over 100 degrees. I don't know the exact number. It's a recommendation, as I said. It's not a regulation, so it's not my specialty. But I've seen it. It's over 100, I think 100.3 or something like that. That's what the CDC is recommending. I highly recommend you just go there, follow what their directions are.
Okay, thank you.
Mm-hmm.
Another highly asked question. Do you have any thoughts on using intraoral isolation systems like Isovac or rubber dams?
There again, that's not OSHA. That is their preference on what they're using in their office. You're still going to create splatter spray using an air water syringe or the handpiece. So, you know, I really don't want to make that recommendation. They need to determine in their office what's best for them. I mean, the dams are there for a reason, not only to protect the patient but it does keep a lot of saliva from getting in the area. So it's probably a good idea, but that's not something that I would recommend. Comment on.
Okay, thank you for that. And then there are a lot of questions about screening staff before returning to work. You know, should they be tested negative for COVID-19? How should we screen staff before we all go back to the office?
Well, remember, that's where you actually need to address your HR specialist. You need to talk to somebody that gives you the okay of what you can and can't do with your staff. You're screening your patients. There's probably some guidelines in place there with HR that are telling you what you can and can't do with your employees. Screening is probably a good idea as far as you don't want people in that have the potential of infecting your office. So you just address that with your HR.
Great, thank you. And then there are some questions about, you know, training staff surrounding these new measures. Is that something that can be done remotely, like via Zoom webinars, or is that something that's going to need to take place in
The
person?
training your staff, you can train your staff however you want. It doesn't matter. OSHA just says they have to be trained. They don't care. Webinars are just like having seminars because you're able to ask questions. As you can see, that's what we're doing. So these are training classes that are personally involved, which is what OSHA requires. The OSHA does not like training classes where the people being trained can't ask questions. There are classes where you can take for like CE units for the dentist to renew their license, where they don't have to be in a seminar situation. They can actually just go online and learn. That's fine. OSHA doesn't like that kind of training. OSHA wants the people being trained to be able to ask questions so they can, it's interactive. That's what OSHA wants. That's what they require is interactive training. So any type of interactive training.
Great, thank you. A lot of questions about using ultraviolet light disinfection versus usual disinfection. Yeah,
I like ultraviolet light. The only problem is I can't tell you that can be the only thing you use. The reason being is because in California, we have the minimum standards of infection control, Title 16, Section 1005. It says very clearly it must be a Cal EPA approved disinfectant. Ultraviolet lights are not a Cal EPA approved disinfectant. So whether they're going to ever update that, I don't know, but ultraviolet lights work. I like them, but you still have to use a Cal EPA disinfectant.
Thank you. Then a lot of people are asking about using Cavitrons at this time.
I would do the minimal amount of aerosol procedures you're going to use. The ultrasonic scalers, the Cavitron, they are going to spray everywhere. Remember what I just said, if you're doing these major, you're supposed to cut down on the aerosol, period. So whether you have that equipment that will suck the air away so it's not getting all over you, that is an engineering control that does work. But that's totally up to you guys. I can't tell you can or can't because OSHA doesn't require it. All right.
And then, Bill, I will finish up with one final question. I'm sorry, we tried to answer as many questions as we could.
I understand.
Please reach out to your local Patterson rep if you have a question that you want to have answered, and we'll filter that up to Bill and get back to you on it. But just leave us with a parting thought. Do you foresee additional changes in regulations once offices are opened back up for general practice?
I won't say that I expect them to be changes. I will say that that's what the interim is for, the temporary guidelines. They're looking at what's going on, and these guidelines are what they're putting in place because they're not going to update the standard immediately. That's what an interim's for. So, and I gave links for the interim for Cal OSHA. That's where you're going to look at where some of the new rules or things that they want to implement. And it could be on a temporary basis. They might not want to change the whole regulation. It usually takes years to change a regulation. So interims are there for that reason, to handle things as they pop up. So there you go.
Wonderful. Thank you so much for being with us today and for providing this awesome information. It was really
you're welcome.
timely and much needed. So many thanks, everyone. Thank you. Stay safe and healthy. We'll have another round of webinars every day next week at noon. So make sure you are on the email list of your territory rep, and we'll make sure you have the links for all of those in advance. And like I said, we will be sending a link for the video of this webinar along with the slideshow and with 2 new products that we believe will be helpful in keeping the environments clean.
Can you send me a link to Cara?
I absolutely will.
All right, cool. Thank you.
Thanks so much. Have a great day, everyone, and a nice weekend. Take care.
Have a good weekend.